The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Morning, George, and it's Tuesday morning.
But it's a special Tuesday today. Do you know what it is today, Herb? Could you believe it?
No, what is it today?
Today is the anniversary of the second year anniversary of the podcast. We've been doing this thing for 2 years. People have been listening to us for 2 years.
2 years I've been hanging out with you?
Yeah, I believe that.
Yeah, I have the gray hair to show it.
I still got hair. All right, so today we have a great guest, Nicole Dulzades, MSRDN. And the topic of discussion for today is going to be pediatric nutrition in the new world of medicine. Welcome.
Nicole's a friend of mine from Miami, which I met at Nicholas Children's Hospital postgraduate conference this last March. She's a charismatic speaker. She worked with nutrition with complicated inpatient children at Nicholas Children's Hospital and had now moved on to helping children in the community. If that was not enough, and years of training, first a bachelor's of nutrition at Florida State University and a master's of nutrition, she's also half Colombian from Medellin, the city of the eternal spring. Welcome, Nicole.
Thank you for having me.
Nicole, we always start with why did you become a pediatrician? But you chose a little bit different path. You became a pediatric nutritionist. Why?
I love working with families and children. And with children, we really prevent chronic diseases. We can promote healthy growth and development. And we're developing all these habits from early on in life. Children are growing, so it's exciting. We can make a lot of changes to set their future up for success.
Why did you decide to stay in Miami at Nicholas Children?
I love Miami, the weather, of course, but my family is here. I have my entire Colombian side of the family here, and my husband's family is here.
What's the best thing about Miami?
Probably the weather. I like warm weather.
The beaches. How silly are you, Herb? The beaches.
The food.
We have a pool, the food. Yeah, there's a lot of exciting things. The culture is really nice too, very welcoming and friendly when you meet the right people.
And why did you decide to stay at Nicholas?
Working with children, I had an amazing team, amazing coworkers, and I really loved what I did in the nutritional management of diseases, tube feeding, surgical patients, and I just really enjoyed the atmosphere of Nicholas.
Every time I go down to Miami and meet with their leadership and their attendings and you, everybody at Nicholas is so happy and so friendly. It's so unbelievable. They're all so friendly.
A lot of smiling faces, yes.
Yeah, it's a great place. Nicole, what is the difference between Peds Nutrition and the big children's hospital and Peds Nutrition in the community, which is what you're doing now?
Yes. In the hospital setting, we do the nutritional management with disease or someone with a diagnosis, versus in the community, it's been more of a health promotion and disease prevention and working more with wellness in the community, which is just a little different, but along the same aspect of nutrition intervention.
Now, you shared with me in Miami that being a nutritionist at a children's hospital is emotionally draining. There are a lot of sick children with a lot of chronic problems and a lot of heartache.
Yes, that is true. It's always hard, especially I have children of my own now. So a lot of it hits home. It helps me be a better dietitian because I have an emotional connection with the families and we can work together as nutritional management with that. And it's also led me more into the community to deal more with wellness, working in schools, and just promotion with healthy children.
What is happening to our children? Why are we seeing adult disease creep into 10-year-olds? 10-year-olds with obesity, hypertension, prediabetes. What's happened?
The long story short, it's pretty much poor diet over time leading to obesity. And so obesity, whether it's in a 10-year-old or in a 40-year-old, it's still obesity. And we can still see the fat stores and all of the complications that can lead to it. And it comes down to poor diet from the start.
And how do you think we can change that trajectory? Because I see it in the clinic and it's only getting worse.
Yes, it's challenging. And really, we just have to improve health by empowering our families, our clients to help change and make these lifestyle choices and overall wellness, and teaching them how to eat instead of giving them these diets or bad diets that are out there on the internet, and just teaching them the empowerment that they could make changes and small changes to help better their life.
So, nutritionist is a combination of a very skilled scientist and a change agent. Someone, a motivational coach, is trying to get you to change the way you're going about your eating habits.
Yeah, exactly. And it's not a full flip. It's just small changes here and there. Sometimes you don't even realize that you're changing because they're so small, but they do make a difference and an impact on blood levels and weight status.
Nicole, what I've seen in a private office is when you have an obese child, you generally have an obese sibling, usually a husband and a wife.
Correct. And
Everybody seems to be obese.
a lot of family interventions, counseling. And now that I'm in my own practice, it could take place in someone's kitchen, and we really work to make those changes. And it's a family lifestyle change. And I always give the parents goals to change as well, and children.
Mm-hmm.
It's interesting to me too in the clinic that some of these parents don't realize what's happening to their children. Like yesterday, I said to a mother, she wasn't there for a well child, she was there for something else. And I said, have you realized that your kid has gained 40 pounds in the last year? What are you feeding her? Because we can't gain 40 pounds a year. And she was like,
Healthy. Salads and fruits and vegetables. I drink water and they play sports. How do you answer that?
That's a really common answer. And you really think that, or they say they don't eat that much, which is also can hurt your metabolism because you need to eat actually. And a lot of times it's hard getting them to see it and talking about the future complications. And what I like to do is just focus on what they could add to their diet more than just like take away the sugar, take away the processed foods, take away the fried foods. Instead of focusing on that, I like to focus on, let's try to add this broccoli to your dinner one night and try to encourage those grains, encourage those fruits and vegetables, and focus more on the positive has helped steer some of my families to make better choices.
so tell me, how does the nutritionist help? Because in my mind, I say, see where pediatrics is in the US today. We're failing. We don't have a good payment model for pediatricians. The match was horrible this year. Young doctors don't want to be pediatricians. Pediatricians are retiring early. And many communities don't have access to pediatricians. And in my ideal world, I think that I would like to have someone like you in clinic to talk to all the 9-month-olds, the 2-year-old, the 5-year-old, and then when they transition from middle school to high school about healthy habits as far as eating. But there's no money for that. No one would pay for that.
Yes, it's challenging. And now some insurances are taking and accepting nutrition, but not all of them. So it's been on the back end for a while, but it's progressing and there's a lot of grants out there and hopefully insurance can help. And also families need to want it. They need to have some kind of motivation to seek out learning about nutrition. If they're closed-minded and you don't want to make any changes, it could be a little challenging as well.
I heard this in a podcast. It was a phenomenal podcast. They called it was a business podcast. They called it the rapid feedback loop. So the problem I've noticed through my career is that diseases like hypertension, diabetes, obesity, they don't cause you pain. And because it doesn't cause you pain, you don't address it.
Exactly. I can agree to that.
But if I kick you, and I tell the parents, oh, this is a terrible analogy, and I go, but you're not going to forget it. If I kicked you in the ankle right now, you would either punch me back, have me arrested, go to the ER, get your ankle in a boot, get it x-rayed, because it hurts. And so you address it immediately. But these diseases that are quiet killers do not cause us pain. And when the pain comes, it's too late to do anything about it. You're on a gurney in the ER with a heart attack. It's too late. The game's over. I would love if the public health system in America and the payers, the people that finance healthcare in America, would be more proactive and include nutritional consults as part of the scheduling of routine well child for education, so that we are in the preventive side.
Yes, I would love that.
but we're nowhere near there. Now, I was very interested, especially because of Jim Riley is a phenomenal pediatrician at RBK Pediatrics. And he is a pediatrician, a lipidologist, and an obesity doctor. He's bordered in all three. And Jim talks about anti-inflammatory diets and how that can change your life, prevent cancer, delay onset of diabetes, all of these things. And you had it on the slide deck, but you didn't delve into what is an anti-inflammatory diet.
Good question, Ante. So there's a lot of labels on a lot of diets, but ultimately it's very similar to the Mediterranean diet, which basically focuses on balance, moderation, and focusing on fiber-rich foods, vitamin C, omega-3s, so things like nuts and seeds, seafood, lean meats as needed, tons of fruits and vegetables, and whole grains. Anti-inflammatory is a diet that's labeled like that, but it's ultimately just eating healthy, balanced, and eating all the food groups and all the colors. And these foods are inflammation fighters, so that's why it's called that. And really, it's eating all those foods that we are constantly trying to promote.
I have a question for you. So is steak allowed in that diet?
It is not allowed, as well as there's beer and wine on the diet as well, but it tries to teach the side of like intuitive eating where you eat majority of your life is eating these types of foods, but occasionally a celebration or on occasion, you can have these other foods such as meats or alcohol or other fried or processed foods in moderation and balance.
And so there's a lot of fish in that?
A lot of fish, a lot of nuts, seeds, and that's where the omega-3s are for our brain development. And vitamin C, our immune system, fruits, and fiber with the grains and the rices and breads and things like that.
And my grandfather, who passed away quite a while ago, he was born in the late 1800s. He had my dad give me every day after dinner a tablespoon of emulsión de cod, which is liver cod oil.
The cod oil, yeah, and you're getting your omega, you're getting your iron.
Do you recommend that? Because it is really not a tasty treat after dinner.
It doesn't sound tasty. Even the capsules of omega, some of them are not as tasty. I usually don't recommend supplements or vitamins unless we're not getting it from the diet or we're deficient in it. And you can get all of that from food, just as a little bit more enjoyable.
Yes, my whole childhood, big tablespoon, there's a big pot in the middle of the table, and with the fishermen. I'll never forget it. Now, the more I study obesity, the more I realize that the old adage that I learned in medical school, calories in, exercise calories out, if there's an imbalance, you gain weight, is probably too simplistic and maybe a wrong way of looking at obesity today. How do
Correct.
we really look at obesity holistically?
Yeah, that's a very simple explanation of such a complicated process. We need to look at the whole picture. The whole picture includes access to food, types of calories that are going in, whether it's nutrient dense or whether the macronutrients are balanced or not. There's a lot more that goes into just calorie in, calorie out. They could be just calories versus nutrients in, nutrients out, or calories out.
And we also now know that there is a genetic component. So some people are predisposed genetically to be obese, no matter what they do, really.
Yes, I agree. And again, looking at the whole picture, environmental factors, family history, genetics, and all of that can play a role. And we just have to, that's where the dietitian can come in and we help move things around, adjust the diet as needed. We see any flags here and there, what really needs to change, what we need to focus on to better their metabolism and hopefully prevent obesity-related health conditions.
And then insulin resistant plays a role in some individuals. There are some individuals that are insulin resistant and they become obese. And then there's some skinny individuals that are insulin resistant and are not obese. So that one also plays a role. So insulin seems to be a super hormone for the human being.
Definitely.
And finally, once you do become obese, especially around your gut, these fat cells are incredibly toxic to your body. They're constantly producing inflammation, which makes you not only sick with all the late complications like diabetes, heart disease, kidney disease, blindness, hypertension, all the metabolics, but they're constantly producing inflammation. And unfortunately, that seems to create a loop where you keep gaining weight.
Yes. And it's very hard. And at that point, this individual's lifestyle could be very challenging to change and to add things. But it would be very effective if we could change their lifestyle. And that's when the anti-inflammatory diet can come in, which ultimately is just a balanced way of eating and intuitively and choosing the right types of foods and understanding that when you eat junk foods or other food, you start learning and realizing that didn't make you feel good. And you start leaning towards those healthier foods. And hopefully that could be a way to offset the insulin resistance and hopefully lose weight with diet and exercise.
And then I have to keep it simple because I'm limited to the amount of time I have in the clinic to talk to someone. And also, I'm limited by the amount of knowledge. I'm not a nutritionist. And so I've adapted the Dr. Riley diet. Whenever anybody's overweight, I ask them to do one simple thing, which is cut out all the sugary drinks, all of them, and cut out the cereals in the morning because to me, they're laden with a bunch of sugar. And the kid eats it, goes to school, and at 10, they're starving. And they reach for whatever junk food is in their backpack, and then they eat again. But interestingly, while I was talking to you in Miami, you said that maybe I shouldn't ask them to drop the cereal because there are some beneficial effects of eating cereal in the morning. What was that?
Yes. So I recently read a study about it where despite cereals having added sugar, and we generally don't recommend in excess, cereal can also provide plenty of key vitamins and minerals and help boost intake of whole grains and fiber. So a lot of foods that they would eat throughout the day might not have all of that. And at least if they're going to have sugar or some kind of food with sugar in it, I'd rather have it be cereal than a candy bar because it's at least giving them those whole grains. And if sometimes cereal is a very easy, convenient food, it's relatively economical too. So if they're going to eat anything, I would suggest that and then still cutting out those sugary drinks and other things throughout the day.
But the kids like the colorful cereals like Fruity Pebbles or Captain Crunch, or they don't like the Special K or the cornflakes that really doesn't have sugar. And I've seen kids, they'll take the cornflakes because it's not sugar and they'll put sugar into it.
Yeah. So in that kind of case, maybe if they do some of those sugary ones, I like to recommend sprinkling something into it where you don't even notice, you don't even taste it, you don't even see it. Something like ground flax seeds or something like that to give it that nutritional boost. Or when we do have that, we have it with definitely a lower fat milk, depending on their age, or a low sugar milk or something like that, some fruits on the side. And we don't recommend that every single day, but on occasion, it's okay. Sometimes we have to keep in mind their mental health as well. And if we constantly keep saying no sugar, no drinks, no this, it can affect their mental health. And then they put sugar on a pedestal and then they crave it more and then they want to eat it and it's a treat or they binge on it. So a lot of times I like to just talk about the positives of foods or ways to make these little foods healthier, or let's just add a fruit to your breakfast routine, things like that.
Yeah. The things that I've noticed, the habits that I've noticed by age bracket, it's like the little kids, elementary school age, those kids tend to drink a lot of juices. People think that juice is healthy, but there's a lot of calories in the juice. They drink a lot of whole milk. They think they need the whole milk for the brain to develop. So they drink juices, and then as they get a little bit older, they throw in the Coca-Cola, the Pepsi, the Sprite, and the drinks. Move on to middle school age. What is the vice that these kids have? I've noticed they like to snack. They open up the cabinet or they open up the refrigerator, just stand there and look. What do I want to eat? Or they graze a lot. They take a lot of stuff, or they eat if they're watching TV with a bag of potato chips. Sounds like Herb's childhood. But that's what they do in the middle school age. And then, of course, in the high school age bracket, those kids now, they're eating a lot of fast foods, greasy foods, McDonald's, Taco Bell, very popular. They used to, at least in high school, go and play sports and run around and do things. But today they just play video sports and sit around.
Yeah, it's a big change in today's society. So in those kind of cases, throughout all the ages and milestones, it's when I really talk to the families and I teach them how to have foods available in the home that are nutritious for teaching how to snack, serving a serving size, mixing a serving of fruit with a protein or some crackers, something with a protein, and a grain is a great snack. It's a little more fulfilling and satisfying than just eating chips that don't really fill you up. So those are a lot of ways that we would work with that. Talking about why, not just don't do this, don't do that, but always, but why? Why is juice not as good as a fruit? Why is soda not as good as something else? And we just talk about the why. And I really see the parents like, wow, I didn't even think of it that way. And sometimes they make changes or decrease what they're doing.
Now that you mentioned how I grew up, which is really funny, the typical Colombian mother will feed you breakfast. Then in the middle of the morning, there is a snack. Then you do lunch, and if you're from Bogota, which is the highlands, which is always cold, there has to be soup, rice, protein, and a vegetable, and then dessert. Then in the middle of the afternoon, I forgot what they call it, they have a name for it, but in the middle of the afternoon, you'll eat hot chocolate with bread, and then you do dinner. And people weren't extremely obese. I don't know if it's the portion size or the food is healthier or wasn't fortified. They weren't extremely obese, but they fed you 5 meals every day.
Yeah, but those kids, they went out to play soccer and football and baseball. Now they're playing video games. I bet you there's a problem there too.
Maybe that's what it is.
It is. It's inactivity, playing video soccer instead of real video. If you remember, Herb, when you were a kid, what'd you do? You went out, and when did you come home? When the lights went on the street.
Exactly.
My kids didn't go to the corner to the end of the driveway until they were 11. Because they might taken away.
Oh, yeah, no, yes, it's totally different. I rode my bicycle all around the neighborhood, just loops, over and over again. I love the bicycle.
Yeah.
It's very different. But I wonder what your thoughts are. Here's my diet for people who are moderately overweight in the exam room. And it's the Riley diet. I go, take out the cereals. I personally don't like anybody drinking milk. I think it's a weird thing that we're drinking the milk of cows. So I don't see why people have to drink milk in this day and age. And instead of having cereal in the morning, either boil eggs, scramble eggs, or eat the chicken that was left over from dinner before the kid goes out the door. Those are all easy things for people to do. And if you don't have that, buy some wheat bread and put peanut butter on it and give the kid some toast with peanut butter, 2 if he wants, and then send them out the door. That's lots of protein. They won't feel hungry in the middle of the day. Cut out all sugary drinks, all of them. That includes Gatorade, Diet Gatorade, Coca-Cola, 7-Up, Fanta, Colombiana, Postobon, whatever. If it's Fizzling, it's got sugar. It is not good for you. And then lunch, don't even worry. You have no control what they eat in school. Let them do whatever they want. And then dinner, as you said, protein and color on the plate. And I always tell them, because the population I take care of right now is very stressed, buy tangerines, buy oranges. They don't spoil quickly. They're not expensive. And there's no upkeep. If you buy a mango, you got to peel it. You got to wait till it's ripened. If it ripens too fast, it rots. You got to throw it away. It's a mess. You can put tangerines in the backpack for the kid. Every time he's hungry, you can take one out, peel it, eat it. And it's a wonderful snack. And it's refreshing. It's sugary. It's tasty. And it's good for you. And it's not expensive. And so that's what I asked them to change. And the Riley diet is very effective. I just had a teenage kid on the Riley diet lose 5 pounds in 2 weeks. So what would you take away from the Riley diet, Nicole?
I think that pretty much sums up what we'd recommend. And difference with us is we teach them how and the day to day. And when you want like a quick snack or you want this, like how to get that nutritious meal or snack in. And the Riley diet seems like breakfast is very important. And that's constantly what we're trying to tell these families is breakfast jumpstarts your metabolism for the day. So you have to eat something nutritious in the morning and then go throughout your day. The sugary drinks and actually eating every 2 to 3 hours or 3 to 4 hours does boost your metabolism and makes you ultimately eat smaller meals throughout the day. and more water than those other sugary drinks.
And I learned something from Riley. So proud of myself.
Families want it simple. They don't want it. They don't want this whole complicated thing to change, and they don't want to see all these changes all at once. So little changes here and there really can be effective.
But do you really think that people don't know what makes people overweight?
I think they don't want to know, but they know.
I'm sure they know. It's all over the place.
They do know. And I try not to say one particular food is bad or one particular food is good, because essentially they can all be bad. They can all be good. So we just want to all the foods are great. Let's try to see which ones are better, which ones we can focus on.
And to your point, this is a story from when I was in training in Kalamazoo with Dr. John Whittingham. In clinic came in a kid with a big belly, 5 years old, and he had a Wilms tumor. And I was so mad. I'm like, what have these parents been waiting for? The kid looks like he was a 5-year-old, but he looked like a pregnant lady. I'm like, there's no way you'll miss that belly. How could you not do it? And Dr. Whittingham pulled me to his office and said, let's talk about this, Herb. Incremental change is not registered by your brain. So if you gain a pound over a week, when you look in the mirror, your brain says you look the same as you did yesterday. These parents have been seeing this belly incrementally grow slowly, and it looks just the same as it was yesterday. That's why they didn't notice. So the only way you're going to notice obesity is if you get on a scale and measure once a week, every day, whatever you want. But once you start measuring that it's not your brain playing games because you look just the same as yesterday, the brain can't tell that you gained 6 ounces, but the scale can tell you gained a pound. And then by the end of the week, you gained another pound. And then you're realizing, oh no, I gained 2 pounds this week. If I gain 2 pounds a week this year, I'm going to gain 100 pounds. That's going to be a problem. And I think that's the problem. It's just this incremental change with no pain. The brain says, no need for action. Next. I think that's what the problem is.
It's hard to get them to change if they don't realize it.
Yes. And then the other thing I changed in my lexicon, and I hate it. I hate being PC. I'm just blunt and I tell you how it is. But I do now tell people, if you're a fat, happy person, all the more power to you. And I don't mean that in a mean way. I'm happy for you. But we're going to draw labs. And if your body's not happy and your cholesterol's out of whack and your hemoglobin A1C is now in the pre-diabetic range and your C-reactive protein, your cardio is at 3, which means there's a lot of inflammation, and then you're going to have to change because your body ain't liking you. And that's a problem. So I'm not treating you for the way you look. I'm treating you because your body is telling me that's metabolically sick. And we need to fix that because that's going to have long-term consequences. Then they don't get so angry when you tell them, mother, your kid's overweight, they want to rip your head off.
We don't want, yeah, that was very well said. I love that, how you said that and how they can take that. Yes.
Yeah, but if you're happy and you clap your hands, it's nothing of my business. But if your body, your metabolism is telling me that your body can't take this, then you're not happy. Now, what do you do with the T1D and T2D patients that you encounter, Nicole?
So it's a very similar eating plan that I would really recommend for anyone. It's a healthy eating plan that's rich in nutrients, low in fat and calories, depending on what they need. But it's also still high fruits, vegetables, whole grains. And really the only difference is for them, we would teach more portion control and carb counting to provide appropriate amounts of insulin as needed, and encourage carbs and encourage all the balanced diet, but just accordingly provide the insulin.
And then the big question today. So I just wrote today in the Wall Street Journal. 1 out of 8 Americans is using GLP-1 receptor agonist. What is the role of pharmaceuticals in treating metabolic disorder? Well, not just obesity. I'm talking about your body don't like it. Where is it indicated?
So from a nutrition standpoint, I really try not to use any kind of medications if it's not medically indicated, which means if there's no related underlying condition, high blood pressure, diabetes, even high cholesterol, all of that, that's when it would be medically indicated on my end. As far as going into the fad of medications and take these pills to boost your metabolism or take these pills to lose weight, those don't seem to be effective as much as diet change.
Okay. And probably not as healthy long term.
Exactly.
I get very concerned because I was listening to the scientist at Novo Nordisk who discovered semaglutide. Fascinating lady. She's out in Denmark, a socialist, and loves her job. But she said something that worried me, that semaglutide crosses the blood-brain barrier, and it sits in the white matter of the brain, and it disrupts your dopaminergic center, so your pleasure center. But it binds there and it sits there for a long time. And the analogy that came to mind is there's a lot of sociologists and psychologists that worry that putting young women, 14, 15 years, in SSRIs could potentially be harmful in the sense that a percentage of them will not have orgasms. And when they don't have an orgasm, they don't produce oxytocin, which is the bonding hormone. So they've never really experienced love because they've been on an SSRIs since they were 14 and they're 30 years old. And they've never experienced that human bonding. I worry about dumping semaglutide into the brain of a 14-year-old and letting it sit there and rob them of their pleasures and do it for a decade. Because once they get off the medications, they regain the weight. And what does that do to us? Because we're still a herd of animals. What does it do to our herd? What does it do to our society? I don't know the answers. I don't think anybody knows the answer. But it really worried me. He said that it sits there in the white matter of the brain and it interferes with your pleasure centers. So I guess we'll have to wait 10 years to find out.
Yes. Yeah. It's challenging when people, I've had parents ask if there's just a pill they can give their child to lose weight. And ultimately, no, there isn't. You have to do the work. You have to put a little bit of effort into there to help better your health naturally and effectively for long-term for life.
Yeah. I haven't put anybody on semaglutide. I did on the stimulant with the anticonvulsant. And the reason is simple. The kid's 11 years old. He's 200 pounds. He's already pre-diabetic. The mom and the grandmother, they all struggled with obesity. The mom has had the gastric bypass. The mother weighs 300 pounds and he has high lipids and he's pre-diabetic. And in a person with that genetic burden, that social burden, that metabolic burden already, I just don't think that I can get him to lose enough weight on diets alone. And so I got to pick the lesser of two evils. If I don't treat him, this is not good. But I treat with a heavy heart, worried about what the long-term outcome of this intervention is.
Definitely. And I would agree to use some kind of medication to jumpstart it, something to get them motivated to start losing weight, to help jumpstart that change along with diet, and then hopefully wean off that medication and continue learning and dieting as appropriately for their lifestyle.
I've heard that a lot, that if you start someone on semaglutide for 3 months, for example, and they see the rapid weight loss and they're working with someone like you, they're seeing results, which is a positive feedback loop. And they get encouraged, and then they can go off the medicine and they're learning new habits and they're very happy.
Yes.
So I have heard that many a times. Now tell me about the program that you have started and how that works.
So I've started, it's basically a 6-week program, minimum of 6 weeks. where each week we are learning about macronutrients and we're learning how to eat. And I take account your lifestyle, for example, and then I use the education and we create our own meal plans per se, but our own lifestyle. And I'm there as a motivational coach and an educational coach and a nutrition coach to help throughout this program virtually.
So you do a 1 hour first? Is that the program?
Yes, it's 1 hour initially. I get all the background of the clients, their history. They show me your pantry. What is your usual day-to-day routine, your lifestyle factors, your economic status, supermarkets nearby, what are they, things like that, to learn everything about the client. And then weekly, it's education based on what I've learned from them or what I see the gaps are. I fill in the gaps of where they need to learn how to eat. We talk a lot about intuitive eating, which is eating mindfully and eating until you're full and satisfied versus overly stuffed. So a lot of ways for that. And I've seen a lot of positive results in just the way we're eating, and weight loss is actually happening without even realizing because we've made little changes to diets. And within this 6-week program, it's really not long enough. We keep the program going depending on the client, but if they can commit to 6 weeks, it's very effective.
And the follow-up appointments, how much of a time commitment? Am I committing 2 hours a week with you?
It would be about 30 minutes a week with me.
Okay. And where do you think that the best, I don't think 6 weeks is enough. You think 16, 20 weeks is the magic point?
Definitely. The minimum of 16 or minimum of 12 weeks takes 3 months at least to actually see an effective change. But the 6 weeks is a committed time to dedicate yourself to the program. And then we continue it on for weeks to months in advance until we make the change that we want to make.
And then you said something that interests me, mindfulness. What is mindful?
Mindfulness it's one sense of enjoying what you're eating and also realizing that you're full. Sometimes it takes our brain a little longer than our stomach to tell each other that it's full and we're done eating. Or it's something like, I really like eating these French fries, but last time I ate them, I ate too many and I felt sick. So learning about, okay, I'm going to have a few pieces of French fry instead of the whole container. So you start learning mindfully of what your body needs and wants and understanding what your body is asking for.
So are there some exercises people can do with food to learn mindfulness of eating?
Within my program, the first 2 weeks are really talking about how we would learn that mindfulness and what triggers to identify and how to learn to start eating that way.
I read a book about mindfulness, and one of the exercises in it was to put a small piece of chocolate in your mouth and savor it slowly, as slow as you can, hopefully over 5 minutes, and notice how it feels on your tongue and how it feels when you move it around and how it feels, how the taste buds get activated differently depending on where the chocolate is touching, and then not eat anything else. And then maybe at another day, eat a grape and do the same thing to really understand the flavors and everything that's going, as opposed to how we eat, most of us, is on the desk in between patients as fast as I can so that I can get to the next patient while I'm clicking on the EHR.
Sometimes people don't even taste their food. So yes, those are similar exercises that I would teach, is just slowing down, taste it. What do you feel? Are you satisfied? Like all those kind of things help develop that training of mindfulness and intuitive eating.
Wow. And then the other one, which is fascinating, I did the Bourbon Trail tour in Kentucky. And at Woodford Reserve Distillery, that's my favorite. They have you, they serve you some Woodford, and then they have you take a sip of it like you would a wine tasting. And it burns your tongue. That's what happens when you take the first sip of bourbon. It burns your tongue because it overstimulates your taste. And then they give you a piece of chocolate. And then after you're done eating the chocolate, you take another sip of the bourbon. And then all vanilla and all the flowery taste that has been in that oak barrel while the bourbon ages just explode in your mouth. And it was such a fascinating It was so fascinating that you could give me chocolate and then I take the bourbon and now my taste buds have calmed down and I can really get all these other notes that I had no idea Woodford had. And that to me was an amazing experience as far as how you can really be mindful about the taste of the food in your mouth and truly enjoy it in small sips. So anyhow, that's a
Yeah.
very good experience for me. I like that experience.
That sounds fun.
I see you.
Herb, I have an idea. Maybe you should sign up for her program and see how you progress over 6 weeks and then come back.
Yeah, that would be fun. I have one more question for you. So how can people find you if they want to talk to you about maybe sending patients or they themselves want to join your program?
I have a website, I have an Instagram, and through my phone, we coordinate through there. Locally, I have flyers and business cards that I pass out. And that's probably the best way to reach me is probably sending me a text or calling me directly.
And what is your website?
It's www.skyrosenutrition.com.
Okay, so skyrosenutrition.com. Was there anything I didn't? Oh, wait, I gotta ask you. So, what is Medellin, the most beautiful city in the world, like?
It is beautiful. Not only is it beautiful, but the people are friendly. The food is delicious. And the fact we were talking about when you travel to other countries besides the US, people sit down and eat food and it takes 2 to 3 hours to get through a lunch sometimes because you're sitting there, you're enjoying it. The flavors are there. It's fresh. It's right off the farm, minimally processed, delicious food. I had the best pan de bonos when I was there.
I'm sure.
Pan de bonos is a bread made with cheese.
Mm.
I cannot make it because it's supposed to rise. So it's like a little globe and you eat it with hot chocolate.
Mm-hmm.
And mine just stay flat. They're like little pancakes. I can make some of the Colombian bread, but the pan de bonos, nothing. I didn't make buñuelos.
The water or the flour, the elevation, I don't know. Something is different.
I don't know. I cannot make them. I can make buñuelos, which are very difficult to make. And I can make pan dulce and I can make roscones. But when it comes to Zippo, none. It is a beautiful city. It's the city of the eternal springtime and most beautiful women in Colombia. Everybody's encouraged to visit at least twice. Thank you, Nicole. It's always a joy speaking to you, and I enjoy your lectures.
Thank you very much.
I wish you well, and I hope to see you back in the show or back in Miami next year.
Yes, definitely. Thank you for having me today.
Thank you. Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice and the opinions expressed are solely those of the host and the guest.